Hi, my name is Dr. Stephanie Gan. I'm a board-certified dermatologist at Duly Aesthetics in Hinsdale.
And my name is Dr. Alix Charles. I'm also a board-certified dermatologist with Duly Aesthetics in Hinsdale.
Thank you for joining us for this live virtual event as we learn more about the Sofwave technology and how it can help lift and tighten your skin.
We're excited to have you here with us tonight. Be sure to stick around until the very end. We're going to have a live Q&A session where one of our team members will be fielding your questions that you can enter in the chat response at the bottom of the screen. In addition, as a big thank you to you for taking the time out of your schedule to join us for this virtual event, we want to offer you a 15% discount off of your upcoming Sofwave treatment, provided you book within 30 days of this event. All you have to do is follow the information that you receive at the end of the event to get started.
Sofwave uses ultrasound energy to stimulate the mid-dermis to build collagen, elastin, and hyaluronic acid. This helps reduce fine lines and wrinkles. It helps give a nice glow to the skin and helps tighten and lift. The reason why we brought it to our practice is because it's safe in all skin types. It can be used year-round. It has minimal to no downtime and uses no needles. So this is really the best technology on the market if you're looking for a nice lift.
So the Sofwave device is different from other skin tightening technology on the market, and we're very excited to be able to offer it because of those differences. Most other skin tightening technology requires something invasive, needles, or some kind of a probe or a device that has to be inserted underneath the skin. The Sofwave uses focused ultrasound technology that penetrates the skin to the mid-dermis and stimulates collagen, elastin, hyaluronic acid, providing a lift without having to break the skin barrier at all. So it's completely bloodless. There are no needles involved. It's non-invasive. And because of that, there's little to no downtime. Patients typically look the same after the Sofwave treatment as they did prior to us beginning the treatment. Yet you can still get the same results that you get with other technologies, maybe even better.
So Sofwave has a few indications that is great for, one, lifting the eyebrows. It can also treat the mid-face, so we treat the cheek, under the chin or submentum, and neck to give a nice snatch to the jawline. It also helps to improve the crepiness of the upper arm, and it also is indicated to treat acne scars as well as mild cellulite. We also like to use it on the abdominal skin and thighs to help improve the mild skin laxity there as well. So who's a good candidate for the Sofwave? So I break it down into two types of patient populations. You have the mild laxity patients, so those who are in their early 30s to mid 40s, who just have a little bit of crepiness and they're looking for more preventative treatments. And this is great for stimulating that collagen and giving them that nice glow, that almost like a filtered look. And then the second population would be those who have a little bit more crepiness, perhaps those in the mid 40s and above. And those patients would probably need about 2 treatments to start, spaced 3 months apart, and then yearly for maintenance. So, but really this is safe in all skin types, all ages, and can be done year round.
Probably one of the neatest things about the Sofwave is that it is truly a no downtime procedure. And when I say no downtime, I mean no downtime. We control for discomfort, and then after a patient is treated, they look exactly the same after the Sofwave as they did prior to us starting the treatment. And they could go immediately out to lunch, to dinner, back to work. They can go about their business. They can work out. They can do whatever they want. So you don't have to worry about any kind of downtime. Like most skin tightening devices and most skin tightening treatments, it does take a while to see the results, because while we are applying the heat and the ultrasound right at the time of the procedure, it can take 3 to 6 months for your body to stimulate and generate all that collagen, and every patient's different. Some take a little bit longer to generate collagen than others, but it will take about 3 to 6 months for maximum results to be appreciated from the treatment. So Lynette, what is it that brought you in today? What have you been noticing, and what would you like to discuss today?
So I just turned 50, and I'm really starting to notice kind of, what's happening with that age. I feel like I'm getting heavy down here, getting kind of that jowl effect in my profile jawline. I've tried to take really good care of my skin, but I feel like I need something a little bit more treatment-wise, but something with little to no downtime.
Okay, excellent. So Lynette is a great candidate. She's at right around the right age for somebody to be experiencing the Sofwave treatment, although we will oftentimes treat patients who are younger than Lynette as well. And when I talk to a patient about the benefits, I always begin at the top and kind of work my way down. We originally onboarded the Sofwave because we wanted to be able to lift patients' brows. So that's one of the things that this Sofwave technology can do. Remember, it lifts, it tightens, it generates collagen and elastin. And one of the reasons we wanted to bring it onto our practice was so that we could treat the upper forehead and the brow area and achieve just a little bit of a skin tightening and lifting effect. Lynette's pretty smooth up here, but everyone could use a little extra collagen boost. And so that would be a great thing to do for her. As we move down, we can continue to use the Sofwave to treat rhytids and wrinkles around the eyes. And then also here on the cheeks to give a subtle lifting effect on the cheeks. Now, as you begin to lift from here to down here to the cheeks, I tell patients it's all like a chain. It's all connected together. Lifting here supports the cheeks. Supporting the cheeks and lifting at the cheeks then begins to support lifting lower at the jowl area, which is the area that most concerns Lynette. And so we would treat this area here as well as back over here. And then we wouldn't stop there. We would even go beneath her mandible, beneath her jaw, and address the neck because people get lines and rhytids there. So by treating all of these areas, we can lift her entire face, the forehead, the face, the cheeks, the jowl area, and the neck, all in one continuous unit.
Thank you everyone for taking the time out of your evening to join us for this presentation. We really, really appreciate it. And just as a reminder, you will get a 15% off your first treatment if you book within 30 days of this event.
Again, thank you guys so much. Stick around for the live Q&A session. You can ask questions and somebody will respond back to the questions that you ask. And also be sure to check your email, your text messages. You'll be seeing information from us on how you can book your own personal consultation and get your own Sofwave treatment going. Hello, everybody. I hope you guys really enjoyed that. I hope that you enjoyed and had a chance to view the webinar. I think those of you who haven't met me personally, I'm Dr. Alix Charles.
And Dr. Stephanie Gan.
And we're really excited that you guys were willing to join us and spend some time out of your evening. We're going to take some time now to answer some questions. So if you can see the little box, you can add questions. All the questions are anonymous. So, don't feel afraid to ask any question. No question is considered silly or wrong. We just want to hear what you want to ask, and we'll answer whatever questions we can. And we'll go ahead and get started. So the first question I have here is, are there any side effects or risks associated with Sofwave? And so any procedure that's performed can sometimes have burning, stinging, a little bit of transitory swelling, maybe even a little bit of transitory redness. But I will tell you, for the most part, patients don't experience any kind of side effects, be they short-term or long-term. Very rarely can you get anything like a little singeing or burning of the skin that leaves a little brown spot that lasts for a week or so, but that's also uncommon. I've treated multiple patients, myself, and as soon as they were done, they go out to lunch or go out to dinner with their friends. I treated a family member of mine, and we went out to dinner later that evening, and they looked fine. You couldn't tell that they had any kind of a treatment done. So this tends to be a very, very safe treatment. We use safe settings, and so I think our patients do very well. And you don't have to worry about the kind of downtime that you can have with other types of lasers and chemical peels and resurfacing procedures. So hopefully that answers your question.
The next question is, I just turned 50 and I'm starting to get jowls, and they run in my family. Will this help with the jowls, and how many treatments would you say? So yes, like when we do the Sofwave, we're treating the neck, and then the lower cheek area to help tighten and snatch the jawline. So that is an excellent treatment for the jowls. Generally, my preference is if you're after the age of 50 or postmenopausal, you probably will need starting with 2 treatments spaced about 2 or 3 months apart, and then once a year for maintenance. For younger patients, premenopausal, likely just 1 treatment. And this is a great way to prevent the sagging of the cheeks and prevent those gels from forming.
So next question. Can Sofwave be combined with other procedures such as fillers or Botox? That's a great question, because a lot of our patients are already doing other things. Yeah, yes, it can. The bottom line is yes, it can be combined with a lot of these treatments. You really want to kind of discuss at the time of consultation or discuss with your physician for your particular case. But we have patients who have already had injectable fillers who get Botox regularly. And oftentimes the areas we're treating with filler or with Botox exist in a deeper plane than where the Sofwave is going to be affecting the skin. So it doesn't interact, it doesn't have a bad effect or anything like that. Most of the time, we're not going to do those procedures at the same time as the same day as you're having the Sofwave. We'll separate those out. You'll do them at a separate time, but it's okay to combine procedures. And actually it's advised. I think when it comes to prejuvenation and anti-aging, combination treatments are the name of the game. And so we oftentimes will combine Sofwave with other modalities to perfect and get the patient exactly the kind of results that they're looking to get and to achieve their goal. So that's a very good question.
Next question, will this replace Botox-like treatments? So the short answer is no. So Botox basically helps to relax the muscles underneath the skin that lead to deeper lines and folds, such as the 11 lines between the eyebrows, the forehead lines, and the crow's feet being the most common. Sofwave is meant to target texture and fine lines and wrinkles and help to tighten the skin. So this is not a Botox replacement. It is complementary to what Botox does, like Dr. Charles was saying, that we would use this in conjunction with Botox and fillers to enhance the skin texture and tone.
All right, next question. What is the length of treatment? And it's luckily enough, it's a pretty short treatment. Patients who are going to be with us are here for maybe a couple hours, and some of that time is spent just with topical numbing cream. We discussed during the video that we use a number of different measures to make this comfortable, but one of those measures is a topical anesthetic cream that's applied to the space, and it stays in contact with the skin for anywhere from about 30 to 60 minutes. For the average patient. Then we remove it and we perform the treatment. The treatment can take as little as 30 or 45 minutes. Some patients, depending if they're treating more surface area, they might need longer than that. They might need an hour, no more than an hour and a half though. In most cases, it's probably about 45 minutes to 1 hour. And then, you're free to go home. You're able to go home looking very much the same way walking out as you did walking in. So really almost no downtime. It's a truly a lunchtime procedure if somebody wanted it to be that.
So what is the pricing? So basically, we recommend you schedule a complimentary consultation, and at that time of that visit, we will give you the pricing.
It varies from patient to patient in the areas that we treat. So you want to have a compliment, and all our consults are complimentary, so you don't have to pay for the consult. So once you set up a consult, we can decide and figure out what you need specifically and how it'll go down. Someone asked, how large of an area can we work on at one time? Most of our patients elect to have what we call the full face and neck treatment. And so we treat around the eyes, we treat the cheeks, we treat under here, and then even the neck. And for some patients, that bleeds up onto the forehead. So we can treat that large of an area. You can also treat body. We didn't talk a lot about Sofwave for the body, but you can use Sofwave to tighten skin of the body. So you can treat an abdomen, you can treat the lower arms. And so you can treat very large surface areas to achieve skin tightening and skin lifting. So hopefully that answers your question.
Is this only done in the Hinsdale office? So right now, yes, this is the only location that Duly offers, and so come on in.
Yeah, come to Hinsdale. We're going to be able to offer it in more offices in the future, but right now, just our 40 South Clay Street office in Hinsdale is the one that's available for the Sofwave.
And how effective is this for someone in their 70s? So this is great for all ages. So ranging from those in their, probably the earliest patient we treat is are in the 30s up until age 70, 80. So the caveat is the older, like I was saying, the postmenopausal clientele, they will build the collagen, elastin, hyaluronic acid slower. So that's why we recommend doing 2 treatments versus just the 1 treatment per year.
Good questions. Someone asked, could we please give you our names again? Absolutely. Sorry, I'm Dr. Alix Charles.
And I'm Dr. Stephanie Gan.
And we're your friendly board certified dermatologists at the Hinsdale Clay Street office. So sorry about that. Okay, next question. What lifestyle or skincare habits can help prolong your results after Sofwave? I'm a big proponent, I'm pretty sure Dr. Gan is too, in kind of this holistic approach to taking care of yourself. I tell patients on a regular basis, you should be engaging in basic skincare. There's something that we adhere to called the core 4 basic products that you should be incorporating in your regimen. And most of our patients have already heard about this or talked about this. I'll give you a real quick blurb that it involves sunscreen, antioxidants, vitamin A and growth serums. But when you have your Sofwave consult, you can actually ask the esthetician about this. We believe that you should be pairing things like Sofwave and other treatments like Sofwave with your core 4 products. I do think, healthy lifestyle in general, sun avoidance, eating healthy, exercising on a regular basis. I think all of these things contribute to helping you look your best and feel your best. And I think an optimally functioning body will automatically make the skin glow. Not smoking, not ingesting, agents, too many agents that are toxins or that are harmful for you. I think all of those things can help prolong your life, add life to your years, and probably extend the results of your Sofwave and other procedures as well. Did you want to say anything else about that?
And one thing that's unique and nice about this treatment is this can be done year round. So we do recommend staying out of the sun because that will undo a lot of the benefits you get from the Sofwave, but it's nice that it can be done both in summer and in winter, unlike some certain lasers.
All right. So somebody asked, how many patients have we treated so far in our office? Many dozens and dozens. Lots of people. Can you do other collagen stimulating treatments in tandem? And, you know, I kind of touched on this earlier. The Sofwave affects a certain layer of the skin. It helps with fine lines and wrinkles. It helps a lot with lifting. But for example, if a patient comes in and they say, you know, Dr. Charles, I've got all these brown spots, I've got all these sunspots and things, what can I do for them? Well, then I'll recommend some other complementary treatments. It might be our intense pulse light treatment. It might be one of our resurfacing lasers. It might be a chemical peel. We'll talk about other things that we would recommend in tandem. Some of our patients do other laser procedures or microneedling, different things like that. So this is just a piece of the puzzle. I think it's a powerful piece of the puzzle, but it's a piece of the puzzle that we try to help put together for you to, you know, to lead to a plan based upon whatever your goals are. That's what you know, that's what our consults are about. That's why we like to meet people face to face and talk to them about, you know, about what we can accomplish for them.
How is the result different from Fraxel? So Fraxel is a laser treatment that we use. It's considered a non-ablative fractional laser. And this Fraxel is used to target fine lines, wrinkles, and pigmentation. So the main difference between Fraxel versus Sofwave, they're complementary because Fraxel, I would recommend to someone who's had heavy sun damage, who's looking to erase the sun damage or photo damage, erase the brown spots, versus Sofwave is for someone who has more skin laxity. So who have like the deeper lines here, and it's meant for tightening because it's building that elastin, which is like the rubber band in the skin. So we're helping to tighten and give that jawline back. The Fraxel is not really intended for tissue tightening. So we can actually do a combination therapy where we do the Sofwave and then the Fraxel the same day. And so you're building all at once and getting rid of pigmentation at the same day.
Yeah, that's an excellent combo treatment because we're not treating the same layers or the same levels, and the patient's already numb and you're already in our office. So we've done that a few times and patients get really pretty fabulous results. So let's see, does it help and eliminate rosacea? And what about those of us with sensitive skin? The Sofwave is not indicated for treatment of rosacea. We have many other ways to treat rosacea, both medically and on the cosmetic side. So if that's something, an issue that you have, definitely come and visit us so we can talk about your particular case and figure out what we can do, because there's lots of different types of rosacea. Some people just have redness. Some people have acne-like pimples. Some people even have enlarged and thickened tissue of the face and the nose, and we can treat all forms of rosacea. So definitely come talk to us about that. People with sensitive skin will take, you know, delicate care of them. Because the Sofwave does penetrate deeper into the deeper layers of the skin, again, most patients tolerate it very well. We've had some patients with more sensitive skin still undergo Sofwave treatments and do very well. I haven't had anybody have any untoward type side effects or certainly any long-standing, undesirable side effects. So I don't think that's something that you have to deal with.
What other facial treatments do you typically combine with Sofwave? Halo, peels? So that is a good question, and it really depends on your specific concerns, and so it's best addressed during the consultation. So we can combine Sofwave with, generally I would think about it as with like fillers, Botox. If you have like the brown spots, we might recommend Fraxel or peels, and so based on your consultation visit, we can give you more information at that point.
All right, somebody asked just a little quick blurb about redness, which we discussed, but then also about under eye bags and wrinkles. We can't treat exactly like all the way up to the lid margin with Sofwave, but you can treat below the eyes, and it can help with some wrinkle. It can do some tightening a little bit under the eyes. I would say, again, this is a question that's really best addressed in an individual consultation, because there's a wide range of ways to treat under eye bags and circles. Some patients really do need surgery, and we're not afraid to refer you. If you do need a surgical fix to your issue, then we're going to help you find the best surgeon possible to get that taken care of. If it's something we can fix non-surgically using the Sofwave or using another one of our lasers, one of our, like say a CO2 laser, or perhaps in some cases it can be fixed with injectable fillers, or in some cases just topical things like eye creams, or even with antihistamines, believe it or not. Some people, I give them antihistamines and their eye bags get better, and then they don't need to do any kind of a procedure. This is one of those things that you're probably would do best coming in, talking to us face to face. We can see what it is you're actually dealing with, and then we can come up with a plan for you.
I recently lost weight and the additional skin is making me look older. Will this procedure work for the falling skin? So this is a great question because now with the advent of the GLP-1 medications, weight loss is a hot topic in the cosmetic world. So we actually recommend doing the Sofwave at the time that you're starting your weight loss journey, because without that fat supporting the skin, you will notice the deeper lines and wrinkles a lot faster. So if you're able to build that collagen and elastin as you lose your weight, it will not be as noticeable.
Somebody asked, how does this differ from the Forever Young BBL? Quick and dirty answer, BBL is another word for IPL. It's specifically Cyton's version of the intense pulse light. And so that works at a completely different level. What we're talking about is something that stimulates collagen, elastin, hyaluronic acid, treats deeper lines and wrinkles, and creates a lot of lift. So this could be complementary with an intense pulse light treatment such as BBL, but it's not, they're not in the same category or the same genre, and they affect different areas of the tissue and achieve different results.
If it takes 3 to 6 months to show the full effect, when will you need to get the next treatment? So like I was saying before, in someone who's like postmenopausal, I recommend 2 treatments spaced about like 2 or 3 months apart. And you will see the final effect about 6 months, and you will actually studies show that you will continue to build that collagen and elastin even up to 12 months. So generally we want you to come back in about once a year for maintenance treatments, because doing cosmetics is kind of like walking up a downhill escalator. Over time, you're losing all of those key components to the skin, the elastin, collagen, and hyaluronic acid. So you want to maintain those results to keep you looking your best.
Somebody asked, just how well does this work for the neck? Do you have any before and after pictures you can show us? We can't show you B&A photos here like this. That's not a functionality allowed in the webinar, unfortunately. But we do have before and after photos in our office. We have a flip book. We have some before and after photos that are from other practitioners. We have some from our own office. When we luckily enough have some patients that don't mind us showing off and showcasing their results. We always ask permission, of course. And if they say yes, then we are sometimes able to use their photos and show you their photos. But otherwise, you can come in here during your consultation. We can show you some of these before and after photos. There may be some available on the Sofwave, some limited ones available on the website for the Sofwave itself, the manufacturer website. But otherwise, yes, the bottom line is yes, we have photos. We can't show you, there's no functionality to be able to show people photos and click them and show digital photos or anything during this webinar, unfortunately.
And as a reminder, you will be receiving a text message. Please reply to the code with the word Duly, D-U-L-Y, to be contacted for a consultation.
All right. And so we're getting closer to the end of our questions. So let's see if there's any that we've missed. Somebody asked, can you do multiple facial areas at once? The answer is yes. You can treat multiple areas on the face. You can treat around the eyes. You can treat the cheeks. You can treat the jowls. You can treat the forehead. So there's yes. So the bottom line is yes. You can treat more than one area on the face all at once, and that's actually pretty typical for patients to do.
So another question is, how does this treatment work with Sculptra? Does it replace Sculptra? So that's a great question. So Sculptra is one of our biostimulatory fillers. So basically, the medical name is poly-L-lactic acid, and it is a powder that we reconstitute with water and with liquid, and we inject it into the skin. So it's a series of 3 treatments, generally 1 month apart, and it builds collagen. So Sculptra is only a collagen builder. The second thing is that Sculptra, we're able to inject it at deeper levels under the skin compared to what Sofwave can get. So Sculptra gives more of a collagen building, so it improves the fine lines and wrinkles. It does not do tissue tightening. unlike the Sofwave. And yes, you can do them in combination. I would probably alternate them every other week.
Somebody asked a really great question. How does this compare to Thermage or Ultherapy? And I think that's a really, whoever asked that, ding, 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 that's a great question. I think there's a place for all these technologies. Thermage and Ultherapy, no one will tell you that they don't work, because they can and do work. And we actually considered those specific devices as well when we were looking at what we wanted to have here in our practice. So this is something we talked about a lot before we finally decided to pull the trigger and get the Sofwave. However, what I'd say is one of the issues with the Thermage's technology has been around for quite a while. And when we spoke with some of our colleagues who had used Thermage, some of them said that there were some patients that really didn't see results as reliably with the Thermage as they did with the Sofwave. And we wanted something that we could say, hey, the vast majority of our patients, or really all of our patients, are going to see some kind of result. So that was something that we wanted. Like Ultherapy, the Sofwave does use similar technology, similar ultrasound technology, but it targets an area that's a little bit higher than Ultherapy. Ultherapy, the way it was designed, is supposed to target something called the SMAS, which is a kind of connective tissue area where your facial muscles connect, and it kind of tries to tighten the SMAS and lead to a lifting effect. So it goes much deeper. It can be a little bit more uncomfortable, but that can sometimes lead to more downtime and more side effects. And we wanted something that was truly going to be like a lunchtime procedure for patients. I really do think Thermage and Ultherapy have their place, and I think they're good devices. And actually, I remember there was a really great dermatologist who I know, and I asked her about which device, should I get Sofwave or Thermage, which should I get? She said, well, I have both in my office, and I think we can use both for different reasons and different ways. But we ended up going with the Sofwave first. So it doesn't mean that we won't end up having some other device if we think that it's complementary to what we do. But we thought that the Sofwave was a good place to begin for the vast majority of our patients in terms of giving them the kind of results that they would desire.
I recently had a microneedling treatment. How soon should I wait before considering this treatment? So technically, as I would say, you can wait 1 week primarily to make sure that the epidermis is completely healed, but you can do the Sofwave even as soon as like 7 days after.
People oftentimes ask, this is a great question, how long will the results last? And I think that's a question, the majority of people ask how long will this last anyway? They ask that about everything that we do. And I tell patients, the longevity of your treatments depends on a couple of different things. One of the things is the patient that we treat, because the analogy I use is a slide at the playground. Imagine you've got a really long slide, and the slide is the slide of life, the slide of time, passage of time, and you're sliding down the slide, down, 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 down. When we do a treatment like this, the Sofwave, we're going to grab you by your collar and pull you back up the slide. So you're at a higher point in the slide, but we are going to have to let go. And then you're going to continue, the slide again. So unfortunately, while we can rejuvenate the skin and help make you look better, we can't completely stop the passage of time. If you've had a lot of sun damage, or if your body's not producing, collagen at the rate it was when you were younger, then, you will degrade your collagen. You're going to continue to live. You're a live person. So some of the results will fade over time. It's expected to get touch-up treatments of the Sofwave anywhere from every 12 to 18 to 24 months to help maintain the results that you have achieved. We haven't had our device long enough to have many patients coming in for that touch up. We've had people come in with fabulous results immediately after just a month or two, or even 3, and up to 6 months. But we do expect that patients will have to like many other things, will have to maintain the treatments with by seeing us and having more treatments done.
Does this procedure work well for the inner thighs? So it works well for tightening the loose skin, so underarms, like inside the arms as well as the thigh area. Yes, it's great for tightening. It also has an indication for cellulite, so it helps improve it. I would say more temporarily, that one you would have to maintain more often, as well as it's great for acne scars as well.
All right, I think that's about all of our questions that we've gotten from people. We really, we really appreciate you guys taking the time out of your schedule. Like I said, you asked some really great questions. We love this treatment. We've seen some great results from it. And so we're hoping that maybe you'll be one of the people that's going to be inspired. Set up a consult so that we can talk about the possibilities for you with the Sofwave.
And let's say, you think about it and you're like, hey, I don't think Sofwave is right for me just now. If you come in and you schedule a Diamond Glow facial within the month of April, you will get one of our favorite skincare products on the house.
We'll give it to you for free, just as a good, just as a good faith, because you stuck it out. And we know the Sofwave isn't for everybody, but we want everybody who at least stuck around and listened and asked questions and things to get a little something out of it. So, and Diamond Glows are fabulous. You can, there's a picture of me or a video of me getting one on my Instagram. So, and you can see my skin glowing immediately afterward. And so those are great for before events. So thank you so much for spending part of your evening with us. We really do appreciate it. And I hope you guys have a great rest of the week, and we'll see you the next time, okay?
Thank you for coming.
Thank you so much for coming.